I'm screaming, doctor, doctor.
Honestly, I think this is my favorite day of the week, not because it's hump day, but because it's Dr. Stan Day. It's Wednesday, and that means we're going to check in with our favorite family physician, Dr. Stan Anderson. Good morning, Dr. Stan.
Pam, it is great to talk to you.
Great to talk to you as well. And, you know, honest to goodness, if I counted everybody who got COVID, not necessarily, a bad case of it, but, tested positive, the whole thing in the last 3 months, my gosh, I could get rich if I had a penny for every one. It was a lot of people recently, right?
Yeah, it has really been significant. So the numbers that the CDC is looking at are never going to be as accurate. So the official numbers are going to underestimate the number of people that have had COVID. The reason is a lot of people can get it, they can run a test at home, and they just quarantine, they just shelter in place at home. They don't seek advice, they don't seek medical issues, and so, yeah, the official numbers are way under what it actually is. Personally, as far as our office is concerned, I think we've diagnosed somewhere around 100 people with COVID just over the past couple of months. So it really was a significant upshoot in the number of people with COVID. The issue for us, a part of the people, I'm not going to say a significant majority because that's not true, but somewhere around 9%. That's what we're seeing, and that's what the official government numbers show. People end up getting this much longer reaction. So whether it's a cough that persists, or they have persistent fatigue, or they have a sore throat that just stays there, they're not as sharp. So they don't remember things. Their mind isn't as clear. That's somewhere around 9% of people. And unfortunately, there is no wonderful treatment for it. So there's two different things that I thought I'd kind of like to describe and discuss with you today. The first is if you have a cough and you have COVID and everything else gets better, but you still have the cough, 2 weeks down the road, you're still coughing, what should you do? And then the second is you had COVID and now you are over most of the COVID symptoms, but you just have that fatigue or brain fog or shortness of breath or whatever it is that you have. Those are the two things that I've seen probably the most. The official numbers in the United States are somewhere around 9 million people, and unfortunately, it tends to congregate in states like West Virginia, rural Pennsylvania, Tennessee, Montana, North Dakota, South Dakota. So it tends to be more rural, tends to be more in places where there's more poverty. That's where you tend to see a lot of the long COVID symptoms. So as of right now, there is no cure. There is no treatment that is great. What we do recommend is that you spend more time taking care of yourself the best that you can. So if possible, the normal thing is try to get 7 hours of sleep. If you have long COVID symptoms, try to get closer to 8 hours of sleep. 2, try to enhance your nutrition. So if you're fast food, if you're junk food, if you're a convenience food eater, what you really want to do is you want to eliminate all processed foods. We talk about eating the rainbow. So the more colorful the food is, the more likely it is that it's going to have better nutrition for you. So we talk about eating the blueberries, the red raspberries, the strawberries, the peaches, the corn. In other words, just think the colors of the rainbow, the more colorful the food is, the more likely it is that it's going to have the phytonutrients that is going to help you to fight this. And then the other thing is we talk about taking high doses of certain vitamins. So we talk about vitamin C. C is in cat. So taking somewhere around 2 to 5,000 milligrams of vitamin C a day. And we talk about vitamin D, and that would be 2 to 5,000 IUs of vitamin D. And we talk about adding zinc. That's 50 milligrams of zinc. So the combination of those three, plus a healthy diet, plus getting good sleep, then you look at all of the things that are in your life that are causing you stress, and you try to deal with that stress. For whatever it's worth, stress drives long COVID. People that have a lot more on their plate that they're not dealing with as well, or things that are happening, the likelihood of them having long COVID symptoms is just significantly increased. So deal with the stress the best that you can. If you need to, see a counselor. There are so many qualified counselors in Stark County and Summit County and areas around here. See someone that is really paramount to try to get a handle on dealing with the uncomfortable things in your life. So those are some of the things that I would recommend for people that have long COVID, and then just try to work through it. Just realize that generally it too shall pass, but for some people it has been years, and they never get 100%, but they might get to 90%. So realize that for some people, it caused scarring on the internal organs. You end up having mitochondrial defect. Those are the power cells of the cell, and that's what gives you energy. Those are negatively affected because of COVID, and so it is being careful about those things that really helps people that after they've had an infection, and it goes not just for long COVID. This is also the wise thing to do for any disease, any infection, any hospitalization that you end up having, and then you're just wiped out afterwards. Those are the really good things to do.
And is there any way to tell, and I guess probably not, maybe just going to your doctor, but like if something else is going on, maybe you did have COVID and now something else is happening, what's the best way to...
And I'm so sorry. I kind of assumed that most people would have already seen their primary care provider, and their primary care provider would have checked their thyroid, would have checked for anemia, would have checked for inflammation, would have done the blood work and done the original workup. So, yes, if you're having a lot of fatigue, it could be any of the usual suspects. So you need to get that worked up. So I apologize, I didn't mention that. I just assumed that most people that are feeling awful are going to contact their primary care provider to just make sure there's nothing else going on. Thank you, Pam.
No, that's okay.
Thank you.
Yeah, and that's...
The final thing, though, that I just want to mention is chronic cough. So we talk about COVID being a week to 12 days, but for a large number of people, it tends to last much longer. So first off, even if you've taken the Paxlovid, which is probably the best medicine to keep you out of the hospital, there are a large number of people that call back and they say, you know, I'm better, but I'm still coughing. Can you do something about that? Every now and then you can have more than one infection. So do contact your provider. There might be a second infection. That happens frequently enough. There might be a bacterial infection. So oftentimes they will talk about going on something. The most common bacterial infection is Haemophilus. So usually azithromycin is one of the antibiotics that's used. But that's a decision you should talk over with your healthcare provider to make sure that it's right for you. Just realize that a small percentage, around 9% of people who have a cough from COVID, the cough is going to last more than 2 weeks. So don't throw the baby out with the bathwater. Don't give up the ship. Realize that it's just your system interacting with this virus, and it's that JN.1 that for many people, that's the strain that's going around right now. That's the one. It doesn't kill you, but what it does is it can really make you cough for a long time. Right now, the death rate in the United States is somewhere around 15 people per day, which is way better than where we were now 2 and 3 years ago, where we're seeing 3,000 and 5,000 people dying per day. So way ahead of where we were, and just realize it doesn't kill you, but it can really irritate you.
All right, lots of good information, because I know people are out there wondering what's my next step, and that's something that can help a lot of people. All right, Dr. Stan.
Always great to talk to you. Pam, thank you so much.
Talk next week.
Look forward to it.
News, sports, traffic, and weather all morning long on your home of local news. News Talk